Hello, my name is Kevin Murphy from Google Research, and I'm here to tell you about our paper on risk score learning for COVID-19 contact tracing apps. This diagram gives a high-level overview of how contact tracing works. The basic idea is that the user, shown here in green, may unknowingly come into contact with someone who's infected with COVID, shown here in red. And depending on how long the contact lasts, how close they were, and how infectious the index case was, the user may in turn become infected and could propagate the disease. In this case, it's useful for them to receive a notification from the health authority that they may have been exposed so they can quarantine. The key problem is to estimate whether they've been exposed or not. The traditional heuristic is called too close for too long, and it's based on the rule of thumb that if you're 15 minutes or more at 6 feet or less, you may have been exposed. A more nuanced approach is to compute the probability of infection as a function of the duration, the distance between the two parties, and the infectiousness of the index case. The Google Apple Exposure Notification app uses a simple risk score model which takes these three factors into account. The problem with the app is that it requires that health authorities manually specify 14 unintuitive parameters by hand. These correspond to things like thresholds on the Bluetooth signal and corresponding weights, and thresholds on the infectiousness symptom onset time and corresponding weights. To help health authorities specify these parameters, we built a simulation tool where they can adjust the parameters in various sliders and see the outcome. But this is still a lot of manual work, which is difficult to do during the middle of a pandemic. So in this paper, we explore using machine learning to learn the parameters. Ideally, the health authority would record exposure information and corresponding test outcomes from users in an anonymous way. Since we don't have access to such data, in this paper, we use a simulator. We make a simplistic model of how people interact and how Bluetooth signals spread as a function of distance, taking noise and signal strength into account, and a model of how infections are spread as a function of those signals. Given the simulated results, we then optimize the risk score model that I mentioned earlier using various methods that we discuss in the paper. And finally, we measure performance as we vary different simulation parameters. We vary three key things in the simulation. The first is the number of exposures per person. More exposures makes the problem harder from a multi-instance learning point of view. To see why, imagine I have many encounters and I become sick. Then it's unclear which person infected me, and therefore it's unclear which features of those exposures are relevant for causing the disease. The second thing we vary is censoring. I might have many encounters, but if they're not recorded by my phone because I'm not using the app, then I might become sick without knowing it, and this corresponds to label noise, making the problem harder. Finally, we can vary how similar the simulation is to our modeling assumptions. And as this becomes less similar, the problem becomes harder. Nevertheless, we see that the machine learning method outperforms the manually chosen baseline corresponding to parameters proposed by Switzerland and used in many other countries.